Hello everyone, my name is Alisha. Welcome and welcome back to my channel. I hope you all are doing great. I have a very special guest today with me, and she is an ICU nurse and she is working in one of the HSC hospital in Ireland. And we are going to discuss everything about ICU today, about roles and responsibility, what are the benefits, how many leaves you can take and how many overtime you can do, patient nurse ratio and everything. So I would like to welcome Sapna.
I'm very thankful that you have given me opportunity to speak on your channel.
Yeah.
I will try to share as much information as I can.
Thank you so much, Sapna, for your time. And if you are an ICU nurse in your own country, make sure you watch this video until the end. So सपना हम स्टार्ट करेंगे आपके प्रीवियस एक्सपीरियंस से कि आपने इंडिया में कहाँ काम किया और क्या पहले भी आपका आईसीयू एक्सपीरियंस था. सो जस्ट फॉर आवर ऑडियंस, क्या आप बता सकते हो कि आपने इंडिया में कितने टाइम तक काम किया और किस डिपार्टमेंट में काम किया, आपकी क्या स्पेशलाइजेशन थी?
In India, I worked as a ICU nurse as well, and I was working in government hospital. I was having 2.5 years of ICU experience, and other than that, I was having an oncology experience as well. And in total, I have 4 years of experience. Then I completed my documentation work and I came here.
Okay, so in total, when you applied for Ireland, you had 4 years of ICU plus oncology experience.
Yes.
Okay, and have you done GNM, BSc, or MSc?
I have done masters in nursing, and it was my specialization in hepatology. But I was more interested to work as a ICU nurse. That's why I selected this.
Okay,
Profession.
that's great. So you said you have worked in a government sector in India. So this whole 4 years, were you working in government sector?
I worked in government hospital for 2.5 years. I was not getting that many opportunities while after doing masters. It was limited scope in India, I would say, and I find it like we are having a broad scope of nursing here. That's why I moved to Ireland.
Okay. So everybody who is watching, I always say this to everybody. This is the reality even after doing masters and even after doing specialization. Sometimes you'll not find the suitable job which you're looking for. And same happened with her, and then she found out that there is much wider scope in abroad. So Sapna, you were working in a government sector with specialization in hepatobiliary. So why did you choose Ireland and not any other country?
Actually, there were three reasons to move here. One of reason was my OET score. It was Ireland score only. That's why I moved here, and I don't want to go for another attempt of OET. Why we have to waste our money? Then I know that Ireland pays well. That's why I moved here. And third reason is I have few friends here. I thought like it's a wise decision to come to Ireland.
Yes, fair enough. Okay, so this was a brief introduction. Thank you so much. Now we'll talk about your journey when you started in Ireland. So I can't share the name of the hospital in which she is working, but it is one of the busiest HSC hospital in Ireland.
Yeah.
Am I correct?
Yeah.
And we will start with her journey. How did she get into this hospital? How did she clear her interview? And then she took adaptation. So we'll talk about adaptation, and then step by step we'll go further.
Yeah.
So when you were in India, how was your interview? How difficult was your interview?
I would say like I was lucky enough. I have given just one interview and I was selected. I didn't want to wait so long. Yeah, that's why I chose that hospital. After that, the process was quite easy because my agency was also connected with Ireland agency. Then my process was much faster, and then I landed up here.
Okay. And how was your interview? What sort of questions do they ask for ICU nurses? Like I have a particular video for ICU nurses, but if you can just share what type of questions. Was it more theory or was it more practical like questions?
It was not that much theoretical. It was all clinical based scenarios, and they were giving us scenarios, different kind of scenarios, and even they ask about what preparation you have to do before taking an admission, and in case of emergency, how would you call someone for help, and Apart from this, they were talking about what we share as a nurse in India, about our roles and responsibilities in case of emergency, and they talk about scope of practice, how much we are able to do in India. They ask all these things. Rest, like few basic responsibilities, are same here as well.
Okay. So you came here and then I know you got adaptation program. So how was your adaptation program?
Adaptation program was good, lots of learning, lots of experiences, and initial few days were very difficult, and afterwards my colleagues, my clinical facilitators, and we do have perceptors here, were so supported, and they helped me a lot, because it's totally different from India to here. It's totally different. In India, we do have limited scope, but here we have to, like, if I'm working as a ICU nurse, then it's my role, like it's my own decision how I can do much better for taking care of my patient.
So as I always say, nurses play a major role in making a decision into patient care. And that's true, especially if you're an ICU nurse. So as you all know that adaptation program is a bit easier as compared to aptitude test, but Sapna had a different experience about adaptation program when I was talking to her earlier.
Yeah.
And would you like to share about adaptation program? Like few people found it very difficult and few people failed in adaptation or got extension. Would you like to share something about that?
Yes, actually, total we were three nurses who came as a ICU nurse, who was selected in the interview, and we do have here protocols, and we were given a logbook, I would say, for adaptation. Then few people were not able to complete that logbook, and we were in between. We were given many classes, and they were not able to make it up to. Then they were failed after 12 weeks, and initially they were given extension as well, but in the end they were not able to complete those things, and they were failed. And it's not an easy crack, I would say, but still it's
Yeah,
different and worth it.
yeah. So few nurses who came with her got failed, and did they go back or did they stay back? Do you know anything about them?
No, they have applied for a new DL, and then they took aptitude exam. They have done online coaching classes, and they cleared their aptitude exam, and they still are in Ireland, I would say. No.
Okay. And how long they have been given extension for? How long? How many weeks?
An MBI allows for 12 weeks, till 12 weeks of extension, and they completed their 12 weeks, and afterwards they were given one more week of extension, because our clinical facilitators, they have sent a mail to an MBI, because they have spent loads of money. They don't want to send us back. They still want us to stay here. Like, they will support us well, but if we are not able to do it, then it's not anyone's fault, I would say.
Yeah, yeah, correct. So if you're not able to finish your logbook, if you're not able to finish your assigned work, or if your facilitator thinks that you're not able to work in that particular ICU setup, first you will get extension of up to 12 weeks as per an MBI. And if still your facilitator thinks that you are capable of, she might or might not give you one more week of extension. And if you couldn't do even in 13 weeks, then I would say you'll be failed. But good thing that those candidates who got failed, they applied for aptitude test, they cleared their aptitude test, applied for the pen, and now they're working somewhere in other hospitals. So that's a good thing. At least they don't have to go back. So
Yeah.
that's a good thing. Okay, so when you started working as an adaptation nurse in ICU, as it was a very busy unit, how was it your first week?
My first week was just introduction. About initial days, we have to do our safety equipments and bedside checks. Initially I was under preceptorship, and I was given one preceptor. They will tell us everything what we have to do, and how we have to set up our bed space, and how we have to set up our monitor alarms and ventilator alarms, and in case of emergency, if we do need to use main circuit, how we have to do that. These are the checks we have to do before starting, when we are starting our shift. It has to be done within 15 to 20 minutes when we are starting our shift.
Okay, so first week is more or less like assessment.
In first meeting they will just say like how we are doing, like they will just basically how we are communicating and about time management. In first week they will assess these many things, but the real assessment they start from second week, and from second to sixth week they will be giving one study day. In each week we will be getting total 4 study days, and apart from this they will be assessing in between. Clinical facilitators will be they will be doing our bedside inspection, I would say. They will check each and everything how we are doing as per our documentation wise and patient safety, and our equipments check and everything they will assess. And apart from this, those 6 weeks, if they want to, if they do want to extend the adaptation, then they will tell us in second meeting where we are lacking, so that we can improve ourselves.
Okay, so that's good. If you're lacking in some areas, your preceptor will let you know in second week and you can improve wherever you are lacking. And in next meeting, if you're still lacking in those places, then you will be given extension. So you still get many chances to improve yourself.
Yeah.
So, one of the most important question, which I would say everybody keeps asking me, do we get any money in adaptation when we are working as an adaptation nurse?
Yes, we do get salary in HSC. We are getting every 15 days, and it is student-based salary. As adaptation nurse, it's in different INMO scales. It's there, and we do get salary.
You do get some sort of money, and I think everywhere, whether you work in HSC or private, it will be somewhere around 900 to 1000 euros
Yes.
after every 15 days. So you will be working 3 long days, which means 12 or 13-hour shift. So 3 shifts per week, and after 15 days you will be given 900 to 1000 euros depending upon your hospital setup and location. So, Sapna, as you have cleared your adaptation with flying colors and now you're working as a registered ICU nurse, what tips would you like to share with our subscriber?
We should stay sincere about our roles and responsibilities. And here people are very punctual about everything. If we are getting, it's not like they are very strict, but still if we are late, then we should inform this beforehand. We can inform anyone of our clinical facilitators or our CNM as well. And apart from this, I would say like we should like it's different, it's very different from India. We do have to adapt ourselves in new healthcare. And if we are facing some issues like in communication or other, I would say like in communication, or we are lacking in something, then we should know like where we are lacking, and we should inform them. They can provide some study material, and it will help to build confidence and to gain our knowledge.
That's very good tips and tricks. So, improve your communication, time management, and just be polite and punctual all the time. And obviously, you have to improve your theory and practical knowledge as per the standards here. Now we will move on to staff nurse roles and responsibility. So, what's the patient and nurse ratio in ICU?
Nurse patient ratio in ICU is 1:1, strictly 1:1, because they are more worried and concerned about patient health, and patient safety is more they are concerned for. And it's strictly 1:1 here, and 1:2 in H2 as well, because I have gone for few shifts in H2 as well, and
Okay.
it's 1:2 there.
So it's 1:1 for ventilator patient or even for non-ventilator patient?
In ICU, it's totally like 1:1. If patient is on ventilator or off ventilator, or it depends. Like if it some patient is of single organ failure and multi organ failure, but still, it's if the patient is in ICU, then it's totally 1:1.
So it's 1:1 in ITU. Doesn't matter if the patient is on ventilator or if the patient is not on a ventilator. It's still ICU patient. And here they called ITU, not ICU. That's why I think we keep
Yeah, yeah,
keep
it's
saying
different.
ITU and ICU in
ICU.
between. So here they call it ITU, not ICU. So moving on to roles and responsibility. Obviously, if we talk about roles and responsibility, it's wide roles and responsibilities, but we'll be very specific. So in ITU, as you said, you have 1:1 patient. So what about patient daily care? How do you manage daily care for patients? And first we will talk about day shift, like when you start your day shift, what all things a nurse has to do. and then we will talk about night shift, how you're starting your night shift and how do you finish. So we'll get to know roles and responsibility of day shift ICU nurse and night shift ICU nurse. So first we'll talk about day shift. So how do you start your day and what sort of work do you start with?
Okay, my shift start around 7:30, and while checking handover, it will take 20 to 25 minutes, I would say. Then after doing this handover thing, I will assess whether my bed space is lacking for something. If I have to stock up my bed space for syringes or needles or some swabs or patient rolling stuff. And then after that, I at around 8, I will start my assessment, and it is head to toe examination I have to do. It's very precise assessment we have to follow. Even we have to auscultate our patient, we have to do neuro ops and pupil dilation, everything. Even we have to check for motor response and verbal response. And after moving towards that, if patient is having ng tube, then we have to assess for at which level is ng and which feed patient is getting. Then afterwards, then I have to listen about bowel sounds if patient is having, and patient abdomen is distended or not distended. And if when the patient open his last bowels, we have to make a note of this everything, because we have to fill this in system. And afterwards, then I have to do one routine ECG. And
Okay, now I have another question. So, as you said, you auscultate for bowel sound and you auscultate chest sound. So, a nurse who is coming from her own country, do we need to carry our own stethoscope or hospital gives stethoscope for all patients?
stethoscope is always available our bed space, like
Okay.
they are for each and every patient we do have it. We don't have to carry our own.
Okay.
Yeah.
But if you want to, it's up to you.
Yeah, it's
Sorry, yeah.
yeah.
We'll continue ECG.
Yeah. Then we have to do ECG. We in during study days of adaptation, they will tell us we have to about ECG course. We will do basics of ECG, and we can do ECG course. It's a 1 day program, and we have to analyze ECG. If we find something which is not normal, then we have to go to doctor and inform them about the irregularities we have found. And we have to check about our pulses, like we have to take radial, brachial, popliteal, and like every dorsal pedalis, every pulses we have to check. We have to do limb assessment as well, whether while touching it's cool or warm. And if it is dusky, then we have to inform doctors. If we don't get pulses like peripheral pulses by touch, then we do have to do Doppler here, like we are following this thing.
Okay.
Yeah.
Okay.
And apart from this, we have done like abdominal assessment, then CVS completed, neuro done. And we do have to check here patient skin integrity. While rolling, we will check for the pressure areas, whether skin is intact or red and blanchable.
So I think this full assessment, it needs to be done by day shift and night shift both.
We have to do like while we are starting, whether it's night shift or day shift, we have to do every shift.
Okay. So once you're finished with your assessment, what's the next thing which you do in your day shift?
If my assessment is normal, then my next plan will be like if patient is on ventilation, then my next plan will be for sedation break. I will decrease sedation. And apart from this, if patient is doing well, and I can bring FiO2 or oxygen setting below the like I can decrease it or not. And I will do one ABG, if so that I can decide like how my patient is doing off sedation and after decreasing oxygen requirements.
So do you need a doctor's permission to decrease the sedation, or is it just a routine for all the patients?
Nurse responsibility, I would
Okay.
say. And by seeing like ABG, then I am the one who has to decide like what I have to do now, like how much tidal volumes I have to give to the patient, and how much oxygen FiO2 we have to increase or decrease. And then here they actually in India we are using PSIMV mode, but here they are using different mode of ventilators. And while working in the same healthcare, we will come to know. And if we do feel some difficulty, then we can go and talk to our CNM and clinical facilitators, and even doctors are always happy to help us. even in few initial days were very difficult. And if you do have some questions, then we can go and ask to consultant as well. They are always happy to teach us.
Okay. That's a lot of information. Even I wasn't aware that nurses are responsible to decrease the sedation and read ABG and just change the ventilation mode. So that's a lot of good information, I would say. So moving on from assessment and then doing ECGs, ABGs, decreasing sedation. What about the doctor's rounds, medication?
Yeah, once we complete all these things, it will be around 9:30 a.m., I would say. Then around 9:30 a.m., we do have, like in my hospital, we will have our night doctors and day doctors round. At that time, it's like, I have to sort out these things. At that time, I have to raise my concern to the doctor, like, I'm worried for this patient, this thing is happening around, and I'm worried, and this is my plan of for the day. Are you happy to continue with the same? And they will tell us if they want to add something, and we have to go for that.
Okay.
Yeah.
Okay, good. And what about the daily care, like giving sponge bath or changing position, ambulating?
Yeah.
And do you ambulate ventilator patients? Yeah.
Yes, we do. After like around 10:30 a.m., I would say we will start rolling our patients, and we do hoist here patients like who are ventilated, especially the patient who are for like ventilated till day 5 or day 6. And if patient is having ET tube, then we will change their position in bed. But if patient is having tracheostomy, or even if they are on high flow, then we will hoist them out, and we need 3 people for that. And we do have like other nurses will help us. We do have some ICU float nurses available, and they will help us. We are having special chair for the patients, and we will hoist them out, like we are having according to body weight. We do have big chairs and small chairs, or like medium chairs also. Then, and apart from this, physiotherapists and occupational therapists are also there. If we do need their help, then they will also come and help us. And if we are worried about, like, if patient is not able to hold their head, if they lose their head control, then they will bring some special chair for that patient, so that we can support their head as well.
Okay. And what about medication? How do you prepare medication? How do you stock medication? And how do you administer medication in ICU?
Medication administration, we do prepare medications around bed space only. And we are having CIS. We have to open our medications list in CIS. If it is not available at the bed space, then we have to get it from a medication room. Before administration, I would say, like, we have to cross check it with another nurse, and it should be cross signed. And we need 2 nurses for giving IV meds or subcutaneous meds, and oral medications we can give our own.
So this is all about day shift routine. Now I think we have covered everything except documentation and charting, which is the most important thing, because if you have not documented, that means you haven't done it. So documentation and charting is very important. So how do you document and chart in ICU in a HSC hospital?
It's online, I would say. Like, we are using metavision for that, and we don't have any paperwork to do in
Okay,
ICU.
that's
We
good.
are It's totally like it's online, and it's all in our CIS and metavision. We have to update our notes, like every, I would say, like when something new happens, every hourly we have to update our vitals, intake, output, urine output, everything we have to update. And if something, like if a patient is seen by any other doctors, or any specific critical situations happen, then like we have to chart it. Once we are free, once we have settled our patient, then we have to chart it.
Okay, so this is about day shift. Now, moving on to night shift. I think in night shift, you're doing the full assessment. And after full assessment, medication. And do you have doctors round even in night shift?
Yes, we are having one night ICU reg available all the time in ICU. And night routine is almost like day routine, but in night routine we just focus about patient sleeping, and how we can manage him or her, like how we can manage the patient. And it's more about patient sleep, and so that patient can rest, and in daytime lots of things will be happening across, so that they can regain energy, and they can get a good sleep, and in day they can perform well.
And what about the change of bed sheet, change of patient clothes? So these all things, do you do in night shift or do you do it early in the morning, or day nurses they have to do it?
They have not given it specific like day shift has to change or night shift has to change. When I feel like my patient gown is soiled, then I will change it night shift as well. If I feel like day shift nurse feels like it's soiled, then they can it's depend upon person to person. And for changing linens, or I would say bed sheet, and we can do it like whenever we want. It's not like they have not given any specific. Yeah, because every fourth hourly we are rolling our patients, then we will change their position and we will check their back and we will reposition them, and if sheet is soiled then we will change it at the same time.
Okay. And do you have enough help? Like, do you have healthcare assistant, or do you have enough help who can help you with these things?
uh, we have healthcare assistant, but still we do have few floats in ICU, and if I'm free then I can go other bed space and I can help them.
Okay, so it's
It's a
mainly
teamwork,
nurses.
I would say, like.
Okay, that's good. So mainly it's nurses helping each other. It's a teamwork.
Yeah.
Okay, so we have covered day shifts and night shifts. Now, talking about your hours of work, as we all know, it's 37.5 hours per week, which means three shifts per week. It could be day or night. So, any changes with that?
No, like for 3 weeks we have to do long days in a week, and then fourth week we have to do 4 nights. It's Monday to Thursday, and we will get 1 week off afterwards, and then next week we are doing Friday, Saturday, Sunday night.
That's good.
Yeah,
You'll have good time off in
yeah, we
between.
will get good time off.
And what about overtimes? How many overtimes can you do in a month, or is there any restrictions in doing overtime? And how do you choose your overtime, or is it just given to you? So, how does it work?
It's depend upon individual to individual, I would say. Like, if you want to work then you can work, there is no restriction. But it depends, like they will never say like you can't work. It's if you are not, even if you are not getting overtime in your own unit, then you can go and work in other areas, and you have to get permission from their CNM, and then you can go and work when you are having your days off.
So that's a very good thing about Ireland. If you're working in any hospital, even if you're working in HSC or you're working in private, there is no restriction about overtime, but of course, you have to take care of your health. If your body allows you, you can do as many overtimes as you want. And I would say you can plan well in advance. As she said, that you'll be given a week off and then you'll be off for a few days before you goes again into shift.
Apart from this, like, we have to look for our own health, and we have to perform well in our own. Like, if I'm working in ICU, I have to perform well in a ICU. My performance for overtime would not affect my ICU job. That's their main concern. When we are asking for permission, these things will be informed by our CNM3 as well.
So that's very important point. If you are choosing overtime, if you're doing extra shift, your own shift should not be affected. So if you're doing overtime, what will be the approximate pay of overtime you will get in HSC as an ICU nurse?
Actually, it's depend upon years of experience. If you are working in day shift, then we will get around 250, that is after tax. And if we are doing night shift, then it will be around 300 after tax.
Okay, so we have discussed about overtime and pay. Now the other important part, which is leaves. So how many leaves you usually get in HSC hospital, like annual leaves or emergency leaves, sick leaves?
Leaves also here, like annual leave hours also depend upon years of experience. If someone is having 1 to 5 years of experience, then they will get around 179 point something hours.
Okay.
Like, it's around 180 hours for 1 to 5 years, and then 5 to 10 years it will be around 186 hours, and then afterwards, like, it will be around 190 hours for off annual leave. And regarding sick leave, if we are not feeling well, then we can call to our department and talk to CNM, and they will allow us to take 1 or 2 days of uncertified sick leave. And if we are not feeling well, then we can go to our GP and they will give us certified certain days. It's like fully paid.
And as you said, all the sick leaves are paid. So, how many certified or uncertified sick leaves you are allowed to take in HSC hospital?
if I talk about certified sick leaves, then in 2 years we can take up to 90 days of certified sick leaves, and that is fully paid, and afterwards till 180 days we will get half paid sick leaves, that is certified. And after this, like if we will get telephonic sick leaves, 7 sick leaves in 2 years.
So, okay, you can take 7 days of telephonic sick leave, and apart from that, 90 days of sick leaves are certified. Certified means it has to be written by a doctor.
Yes.
So that is called certified sick leaves here. So 90 days will be full paid, and if you're taking anything on the top of 90 days, it will be half paid.
Yes.
And what about emergency leave?
Emergency leaves, they are paid. Actually, they will arrange if someone is having some emergency at home, or in India they have to go home, then they can take like around 2 weeks of emergency leave. And we do have bereavement leave as well. If we do, like if we lost our closed one, then we will get 2 weeks of bereavement leave. And if that person is not that much close to us and we are in Ireland only, then at least we will get 2 days of bereavement leave. Here, when I came in Ireland, I lost one of my family member, and I was in adaptation, and I was given 2 days of bereavement leave, and it was very helpful to me to cope up with the situation.
Oh, that's good. Yeah. And apart from all these leaves, is there any other benefit which you would like to share?
Apart from these, like here in HSC they are giving disablement benefit, and if something happens, like suddenly happens with us, like on job, like if we do get some hepatitis C or any other illnesses with the while working in our unit, and we had a fall, then here they pay us for disablement benefit, and it covers up not for like whole life, but it covers up to 2 years.
Oh, that's a good time frame.
Yeah, it's a good time frame.
And also, if you get COVID, they will give you some illness benefit.
They are giving us 5 days of COVID leaves. Like it is self-certified. We don't need a GP for till 5 days COVID leave, and afterwards, if we are not feeling well, then we need a GP certificate for that, and we will get it.
Okay, because I remember when I came to Ireland, I got COVID twice, and both of the time I was given leave. I didn't even know how to apply. So my CNM helped me with the leaves, and she sorted out everything for me. Yes, if you fall sick for something which you're not responsible for, like COVID or some illness, hospital will help you with that.
Yes.
Okay, so that's all about. And I didn't ask you about salary because I know salary would be according to INMO scale. I think only thing is if you work in HSC, there is a mandatory pension amount which they deduct.
Yeah, they are deducting pension amount. Like there are two types of pension, and it will be deducted from our 2 weeks of salary. How much we are earning in 2 weeks, then it will be deducted, and that pension money is deducted before tax, and afterwards they will take tax.
Okay, so is it two mandatory pension or is it only one?
Actually, it's mandatory. Like it's mandatory because we are not selecting like two type kinds of pensions, but in HSC they are dividing it in two types of pension.
Okay. Now I just have some basic questions. So as you were working in a government sector in India, and we all know that workload could be different if you compare Indian government hospital and Ireland. So how are you settling in here, and how are you finding the workload, or how are you coping up with the workload?
I would say like it's good here, and because patient ratio, if my patient bed space, like I'm getting 1:1, if my bed space is very busy, then I don't have to take a stress like, oh my god, I have not given medication for my other patient. That stress is not here. But still, and we do have many helping hands. We do have ICU float nurses who will come and help us. And in case like we don't have anyone around, then we can ask our clinical facilitators, our clinical nurse manager, like whoever is there in emergency situation. We will have lots of people around us, and we are not left alone. Apart from this, I'm very thankful and grateful to God that I got this opportunity to work in Ireland, and I'm very happy here. I would say like I didn't regret like I leaving my government job in India, and it's just matter of time. It will take some months, I would say, like not even days, like it will take months to settle, but it's definitely worth it.
Well, I agree with you. It will take you months and months, and even sometime it takes an year for you to settle in here, because obviously It's a complete different atmosphere, and it's a complete different language, nature of work, everything, it's different. But once you get well adjusted, and once you know why you're here, and once you understand how many people really wants to be here, and you are literally living somebody's dream, it just makes things easier. So, there is one thing, like people who are well settled here, they always discourage nurses who are back home, saying that, oh, you are working in a government sector, you're already making so much money, so don't come here, because if you come here, you won't be able to save any money. I've been talking to lots of people who are in India, in other parts of the country, and they all say, oh, we have heard people saying that it's not worthwhile. There's lots of workload. Ireland is always short staff. So what you have to say about these people? I mean, my question would be, are you able to save anything? And do you think that it's worthwhile?
Yes, I'm able to save a good amount of money because I just have 4 years of experience. It depends upon how you divide your expenses and how much you want to spend. It's individual choice. If you want a big, like good, comfortable life, still you can save money. We can save a good amount of money if we are spending it wisely. We will get lots of opportunities here. In HSC, if we want to do some courses, like if we want to do our post graduation or masters, they will pay for us and we have to stay here for 1 more year with the same hospital because they are paying for it. And about weather, like we will not get anything best everywhere. It's always like something less and something more. If I'm worried about my career, then I have taken a wise decision, I would say.
Well, I would say the same. Like, it will take you time, and yes, it's a whole lot of hard work. It's an ongoing process. So, nurses, they hold a responsible job here, and we have a lot of responsibilities. So, you will feel proud of yourself, if I'm right.
Yes, I feel proud of myself because like my scope was very limited where used to work. I have given my scope of practice and I have to use that scope of practice very wisely so that my patient is safe, I'm safe, and even our decisions are taken into consideration.
Yeah, that's very important. So, guys, that's all about ICU nurse roles and responsibility in HSC hospital in Ireland. So, Sapna, before we finish this video, any messages to all the ICU nurses out there who wants to work in Ireland?
I would like to encourage everyone who are working in ICU to look for everything, how like doctors are taking a decision for changing modes. Or we are always dependent on doctors, like if this thing is happening, if PCO2 is high, and then how we can manage it. See things wisely and we can learn more and we can bring into practice. It's ourselves. We have to take care of like it's in our scope of practice and we should use it wisely, and every day is a new learning day, and if we work hard, so then we can bring up our profession much higher as we want.
Okay, that's a very good message. Thank you so much, Sapna, for your time. Thank you guys for watching this video, and share this video with your friends who are working in ICU and wants to move abroad and work as an ICU nurse. Hope you find this video helpful. Until next time, bye bye. Take care of yourself and your family. I'll see you in my next video.